welcome back to Fight Girls Fight. For those of you that are new to this platform, my name is Shamika, and I am a triple negative breast cancer survivor. All right, you guys, we have been through a few things. I've gotten a lot of questions. I've answered some things. All right, so let's talk about meeting your surgeon. Now, there's two different options that you will have. You could either meet with a plastic surgeon who specializes in breast cancer patients with removals and reconstruction, or you can meet with a general surgeon. My choice was a general surgeon. I did not plan on reconstruction. I decided against reconstruction. So I just needed a general surgeon that was really good at what he did, had great bedside manner, and my doctor is phenomenal. Shout out to him. I gotta get his permission before I say his name. So, but yeah, he was great. His bedside manner, his patience, his information, everything was top notch, and I couldn't have asked for a better general surgeon. All right, so I showed up to my appointment. As you all may have known from previous videos, I already knew that I wanted to have a double mastectomy based off of the triple negative breast cancer results that I received. I had researched it, I watched it done on YouTube, and I watched everything, what he did from the beginning to the end, and what the experience was. My mind was made up. I walked in already knowing, and he was not ready for me. Let's be clear, he was not ready for me. Once he heard like, okay, you know what you want already? Yeah. I don't want a lumpectomy, because they did offer me a lumpectomy. My oncologist, that's something I did not say, did give me my options for surgery. It's like, yeah, you can get a lumpectomy, because this is the thing, ladies, people, women. This is specifically for the women. For some reason, here comes my personality, y'all. For some reason, men think we were born with breasts. Okay, that's what I got. That's how I felt from talking to my PCP. You know what I mean? Talking to different doctors. They think that we're born with breasts, and the reason why I say that is because a lumpectomy kept being brought up to me, and I was like, no. For me personally, not with triple negative. Okay, for me personally, this is a personal decision that everyone has to make. Some women don't want to lose their breasts. Some women, it freaks them out the thought of it. Some women, like me, don't care. Okay, and I'm just being flat out honest with you. I did not care if I lost my breasts. I did not care if I only had one. I decided to get both done. Okay, I only had breast cancer in my right breast, but of course I'm like, nope, take them both, and that's my mind was made up. That was brought up again during my appointment with my general surgeon. Listen, your oncologist messaged me and you can have a lumpectomy. No, thank you. I've already researched this. I'm good. My decision was made. And I know exactly what I want. I already know how far from my clavicle you actually do what you have to. I knew every step that he took. I have my notebook. Woo, the handy dandy notebook, y'all, that had all my information in it. Whoop, spin it around. I know what you do. He was like, let me see that. And he went through and was like, oh, you wrote everything down. Yes. That's how prepared I was. And that is also the magnitude of my decision. I knew everything that you did. You do. I know every step you're supposed to take during surgery and what to expect after. I know the exercises. I know it all. We're going to go over that as well with other videos on the mastectomy and things like that. We're going to talk about that. No worries. But right now we're going to talk about that appointment. Again, he offered me different things, gave me education again, just in case I didn't get all of it, which is what he's supposed to do. He didn't have to go really any further with any explanations or discussion or definitions of anything. This is the surgeon for me who was going to not only do my port, insert my port, but he was also going to be the one to do my double mastectomy, my simple double mastectomy, and he also was going to be the one to remove my port. So this for me happened with one doctor. Some people choose, like I said, to go to cosmetic surgery route where they don't, less scarring, like all that, who want reconstruction. So their journey is a little different than mine. I do know someone who chose that route and is still moving forward with it, because it's not a short type of scenario. You don't get the mastectomy and then your implants get put right in. That's not how that happens. There has to be spacers put in. You have to go see a different, it's a lot of steps. It's more steps than mine. That's why mine is called a simple mastectomy. The port is, I have to pause on this one because this is the port that is coming up in news today, but this is the port that I had. So let me tell you what my port is, where my port was. All right, so right here at the bottom is where my port was originally. This is the incision where my port was placed. Okay, this line is where my port was taken out, but this line right here is where it was placed. It was placed on the right side of my chest. All right, and what did that look like?